For our Week 6 disability presentation, we are going to talk about intellectual disabilities and how educators can effectively teach individuals with intellectual disabilities in the classroom. Intellectual disabilities vary in the level of severity and are caused by many factors, some which are preventable and others which are not. So what exactly is an intellectual disability? The DSM-5 identifies an intellectual disability as deficits in intellectual and adaptive functions such as reasoning, problem-solving, planning, abstract thinking, judgment, academic learning, and learning from experience. Individuals with an intellectual disability may have difficulty connecting actions with consequences, communicating with others, taking care of themselves, and behavioral issues.
About 85% of individuals with intellectual disabilities are classified as having a mild disability, meaning their disability doesn't greatly hinder their ability to learn and function in everyday life. These individuals have an IQ between 50 and 70 and can acquire practical skills and practice self-care, but they learn and develop at a slower rate than their peers. Individuals with a moderate intellectual disability have an IQ between 35 and 49, and they can perform simple supervised tasks and activities as well as learn simple communication skills, but often have delays in speech and lack social skills. Individuals with a severe intellectual disability have an IQ between 20 and 34. While they may be able to perform simple self-care tasks and routines, they have limited communication skills and have significant delays in development. Also, they usually have abnormal physical features which indicate their intellectual disability. A profound intellectual disability is indicated by an IQ below 20 and significant delays in all areas of development. Individuals with a profound intellectual disability need close supervision as they are incapable of communication or self-care.
Intellectual disabilities must be diagnosed before the age of 18. However, in technical terms, there is no age of onset for an intellectual disability. If a diagnosis is given after the age of 18, it can no longer be considered an intellectual disability, but rather it is called a neurological disorder. Causes of intellectual disabilities can be broken down into 4 categories: genetic, prenatal illnesses, childhood illnesses, and environmental factors. Some causes are viral and bacterial infections, exposure to alcohol or drugs while the mother is pregnant, or complications during birth. Illnesses such as meningitis, encephalitis, and measles can cause intellectual disabilities if not treated properly. Cerebral palsy is the loss or impairment of motor function that is caused by brain damage, typically before birth. Cerebral palsy can affect the person's muscle movement, control, and coordination. Though there is no cure for cerebral palsy, typical treatments to help oneself cope with the disorder and help them grow as a person include both physical therapy and regular therapy. Another common treatment is medication such as a muscle relaxant. Down syndrome is a genetic disorder that is caused by an extra copy of the 21st chromosome. Down syndrome hinders a person's developmental and intellectual growth. Common symptoms of Down syndrome include lazy eye, difficulty in thinking and understanding, and delays in speech. There is no cure for Down syndrome, but that doesn't mean individuals with Down syndrome won't live a joyous life, and there are treatments such as self-care and therapy to help them cope. Another genetic disorder is Fragile X syndrome. Fragile X syndrome is caused by the expansion of the FMR1 gene, which is simply a genetic mutation. Common symptoms include delay in speech, hyperactive behavior, and anxiety. Treatments include therapy geared towards the person's learning disability, and medications such as a muscle relaxant and antipsychotic are used to combat their anxiety and mood swings.
Intellectual disabilities affect approximately 1 to 3% of the population in the United States. Of these 6.5 million people diagnosed with an intellectual disability, approximately 0.5% or 32,500 people have a severe or profound intellectual disability.
Positive reinforcement. Students without a disability can lack confidence and have a low self-esteem, and the same is true for a student with an intellectual disability. It is important to verbally express how proud you are of the student when they successfully answer a problem or learn a task. Positive reinforcement will not only increase their confidence, but will also motivate them to keep trying to learn. Your classroom a community. Sounds simple, right? If you turn your classroom into a community by having students set common short-term and long-term goals, it will feel more like a community. Students with an intellectual disability may not feel as though they have the same social and communicational skills as others, so having all students set classroom goals makes the students feel as though they are part of the classroom. Small group discussions. As stated previously, one symptom for someone who has an intellectual disability is a difficulty in communicating and expressing themselves to others. It is imperative as a student's teacher to help them develop social skills, and having small group discussions allows students to practice expressing themselves. This will decrease any anxieties they may have when it comes to speaking or answering questions. Concise and short activities. Since many intellectual disabilities cause the child to have poor short-term memory, it is imperative to keep activities short with specific instructions. This will help the student not become as easily frustrated, as long-term projects tend to frustrate people with intellectual disabilities and many students in general. Lastly, creating activities geared towards the student's interests will help keep the student focused since they are interested in what they are now learning. This will in turn help their short-term memory and reinforce the concept they have just learned, which is crucial for students with an intellectual disability since they have poor short-term memory and difficulty understanding certain concepts.
As previously mentioned, the majority of individuals with intellectual disabilities have a mild disability. Many of these individuals can have jobs, participate in sports, clubs, and other enjoyable activities. With proper support, acceptance, and programs and services like special education and transitional services, individuals with intellectual disabilities can live happy and successful lives. Rosa's Law, named after a 9-year-old Rosa Marcelino, was signed into law in October 2010. It changed the outdated term mental retardation to intellectual disability, promoting respect, dignity, and inclusion for all individuals with intellectual disabilities. Rosa's Law removed the R word from all federal policies and declared once and for all that the R word is offensive and no longer to be used. In conclusion, there are many different types of intellectual disabilities that vary in severity and cause. As a teacher, there are techniques such as play-based learning and positive reinforcement that can help a child with intellectual disabilities learn in an inclusive environment. Every child deserves a quality education and a chance to reach his or her full potential. We hope you enjoyed our presentation.